Hello again. How does one know that one is suffering from deep vein thrombosis or leg clots? You wake up in the morning suddenly and you realize that you have a lot of pain and stiffness in one of the legs and you can't even walk. The leg is swollen, it is stiff and it hurts like hell. This probably is as a result of sudden acute deep vein thrombosis. How do we diagnose this condition? You obviously need to approach your local doctor, go to them and let him identify and look for reasons and causes as to why, A, first of all, what it is, and B, as to why you got it. Secondly, ask him to refer you to a vascular surgeon in your locality, in your area, so that you can have an expert specialist opinion. A vascular surgeon on examination will be able to make out as to whether there is a possibility of deep vein thrombosis or not by A, by the history, B, by also looking and examining you. The examination basically entails feeling the firmness of the calf muscles, the pain on pressure, pain and pressure on touching the patient, touching the muscles, and of course the difficulty of moving your ankle and the pain that it causes. The single most important test which can actually give you almost clinch the diagnosis and is a gold standard is a color Doppler examination. A simple ultrasound examination which is done by a specialist ultrasonologist who will be able to pick up whether there is a clot in the legs or not. If there is, A, the diagnosis is confirmed. B, you have to identify as to what is the length of involvement. Where does the clot start? Where does the clot end? And whether it is involving any other veins anywhere else in the leg. So that has to be identified and it can be picked up very, very easily with an experienced ultrasonologist who can actually come up with the diagnosis and tell you it is indeed leg vein clots. Sometimes there can be a little bit of a discrepancy or a difficulty in diagnosis. Here you can actually go up and get an order, a color angiography or a CT scan with contrast, which is a dye contrast angiography, which can give you a very good confirmation of A, of the clotting, B, of the extent and location of the clots. In case this cannot be done or is not available, you can also get an MRI of the leg veins. That can also actually give you all the indication that is for diagnosis of these leg vein clots. So CT scan, MRI, but of course, as I said, the gold standard is indeed a Doppler examination done by an experienced ultrasonologist who knows what he's looking at and he knows what he's looking for, and then he can come out with a diagnosis. And this ultrasonology actually, or a color Doppler ultrasound, can actually be used to serially map the improvement, because you can't really get a CT scan or an MRI done every week, but you can indeed get a color Doppler examination once in 10 days, a month, 3 months, to assess the improvement in the varicosity, in the venous thrombosis. So the diagnosis can actually be made with a Doppler examination. There are a few blood tests which can tell you, but the routine blood tests do not tell you or diagnose deep vein thrombosis. There is a test called D-dimer, which if it is exceedingly high, does give you an indication as to whether there is thrombosis or not. But this is to be interpreted with caution by an experienced person so that the correct diagnosis can be made. So a color Doppler, that is what it tells you whether you have deep vein thrombosis or leg clots or not.